both of them are very well tolerated. So how do you decide whether what is good for you, whether it's fat or filler? My choice, because we are plastic surgeons and even because it's natural tissue, my choice would always be to go with fat. One is it is your own tissue. You have abundant quantities of it, so you're not searching for anything. It's already there. And thirdly, yes, it is living tissue, so it brings in vascularity, it brings in rejuvenation, and we are replacing kind with kind. That is one of the most important principles of plastic surgery, is replace kind with kind. So aging causes fat loss and we are replacing that fat. But yes, downtime is one major issue, and yes, it's a surgical procedure, so you have to undergo sterility. You have to be done under proper conditions. You can't just do it anywhere. It has to be done in a surgical OT, and then you have that waiting period till that fat settles in and gives you the desired results. Fillers, on the other hand, easy to use, readily available, different varieties, different consistencies depending on where you want to use it.